Hi, my name's Sally Trace. I'm one of the ADHD clinical nurse specialists.
Hi, I'm Jenny Shepherd. I'm one of the other ADHD clinical nurse specialists, and I'm the non-medical prescriber with the Stockport HIMSS team.
This training is for parents and carers of children and young people who are newly diagnosed with ADHD.
This is a course that we used to run at Stepping Hill, where parents used to be able to come and would do the course face-to-face. And that is something that we hope we'll be able to get going again in the future. But obviously, given the recent pandemic and availability of venues, etc., we thought we would get something online, and then at least you have something that you can access and a resource that you can re-look at time and time again if needed.
So the aims of the course are to understand the assessment process. Hopefully you've all been through that assessment process, but it's slightly different between HIMSS and paediatrics. What is the criteria for ADHD and why some people meet it and some don't? What does diagnosis mean for a child or young person? What does it mean to have ADHD? What local services are available for children and young people and families? What role school can play, and how can you help as a parent or carer?
So some of the most common symptoms of ADHD, basically there's three categories. Inattentive behaviours are usually the ones that you would see affecting academic progress. So when young people say that they're not meeting their potential, usually that's related to inattentive behaviours. So this is things like poor concentration, failure to finish tasks, poor organisational skills. This can be in primary school, it might be that they're always the last one to get changed after PE. In high school, you might see that as forgetting to pack PE kits or forgetting to take equipment into classrooms. Avoiding sustained effort, losing things, so particularly school uniform, etc. Being known as very forgetful and often having to have instructions repeated and being very easily distracted. One of the other criteria is hyperactivity. So this is fidgeting. And I just want to make it clear that actually there is sometimes fidgeting presents in different ways. So you very often have the very boisterous fidgeting. So you'll have somebody who will get up out of their chair all the time and walk round. And this is really obvious fidgeting. But there is fidgeting that very often gets overlooked. And that is the fidgeting of fingers, foot tapping. Those that can stay seated, but actually when you look at them and you watch them for a set amount of time, like 10 to 15 minutes, you'll see that they never actually come to still. Sometimes one of the biggest things for this is nail biting. So you might see somebody nail biting a lot, or girls fiddling with hair, or chewing. But it's if you watch that person, that they never really actually come to still. But that is the type of fidgeting that very often gets overlooked and is the most commonly overlooked in a classroom setting, because with lots of other children, you're more likely to pick up on the one that's getting up out of their chair. Running and climbing excessively. So you might have the boys that run up a tree and then can't figure out how to get down. Not being able to play or work quietly, so not having an awareness of the amount of noise that they're making, or always being described as being on the go or talking excessively. They're all signs and symptoms of hyperactivity. Impulsivity, so sometimes young children particularly struggle to understand what we mean by impulsivity. And in its simplest form, it's saying or doing something without intending to. And very often this is coupled with remorse. So you might get somebody that says something or does something and then immediately will go, oh, I shouldn't have done that, or I shouldn't have said that. That's that impulsivity. And within that is talking excessively, blurting out answers in class, so not being able to sit and hold the hand up and actually having to shout that answer out, being unable to wait a turn and being very impatient, so the one that's stood like this in a queue. interrupting others and intruding on others. So within that impulsivity is a difficulty, particularly in relationships and friendships, in that young people who are impulsive very often will invade personal space. And it's not intentional. It's that kind of impulsive overexcitement. I'm in your space. So very often they will back out of it quite quickly, but it can be quite intimidating.
So the things that we talk about with ADHD, this work is taken from a guy called Russell Barkley, and he's really good to read up about ADHD. And he talks about the impairments of executive function. And he thinks particularly that children learn to regulate their behavior very slowly with ADHD, and therefore need lots and lots of constant behavioral interventions. They're thought to be 30 to 40% behind others of their same age with regards to executive functioning, and that's planning, organizing, and sequencing of things. And this carries on well into their 20s. Things that help with executive function are thinking things outwardly, externalizing it. Reduce delays and externalize the time. These kids don't work well with wait till dad gets home. It's talk to them now, let them understand, and have lots of clocks around, timers, things like that. Externalize important information, stickers on the doors, reminders on the mirror in the bathroom, brush your teeth, things like that. Externalize motivation, and it's always a really good one to think about in terms of, I need the bedroom tidying up, how am I going to get it? Well, when you've tidied the bedroom, then we're going to go and do this thing you've been waiting to do. I'm here, I've got a bag to help, this is how we're going to do it. Then you're both win-win. The other thing to think about is externalizing problem solving. This can be sitting down, talking about it, drawing it out, so that you can find ways to think through how that situation arose and what they could do about it. You can help with accountability to others. This can't be always for the negative or tell, the teacher that this is what's happened. Sometimes it has to be really very positive. Let's phone grandma that you've tidied your bedroom, or things like that. They talk a lot about touch more, talk less, and we talk to teachers about that. Just perhaps, hand on the shoulder, that's great. Don't use too many words. Keep a sense of humor, you're gonna need it. Maintain a disability perspective. It's about understanding these children and young people can't change that. This is not something they're doing to wind you up. They're doing it because that's what their body does. And the other important thing is what we call practicing forgiveness of yourself when you get it wrong, and of others when they get it wrong. Let's just keep talking and hopefully try and sort it out. When we think about executive function, we also need to think about anticipating problems, settings, making a plan. This could be for a long journey. And we did a long journey with my family, and we wrapped up little toys so that they could have one once an hour. They were only things that we'd already got lying around or things like that. But it meant we knew we'd got snacks, we'd got drinks, and we'd got little things to open on a very long journey. Make your commands more effective by praising things they do well, really easily and really quickly. It's important to use commands and imperatives. So that just means, and take your plate to the kitchen, not would you mind if you could, just before it's please take your plate to the kitchen. Using touch and eye contact with younger children, it's often useful. So I'm sending you upstairs to go and get your sweatshirt and your jumper. What are you going to get? Every step they go up, sweatshirt, jumper, and they learn to practice that out loud and then in the head. Break down tasks into small, manageable chunks. Reduce time delay for consequences. This is a bit back to wait till your father gets home. Doesn't work. It needs to be clear and straightforward, but not trying to talk about it when child or young person is upset and distressed. Using timers,
So count down or
Yeah. Counting down timers works better. My daughter's got a brilliant one that's traffic lights, red, green, and amber, and that works really well. Don't give lots of tasks at once. Reward throughout the task, and ask the child, that young person afterwards, to perhaps evaluate how they've got on.
I saw